Thank you for watching the video. This is YouTube Medical University. This time the video is about Heberden's nodes. Heberden's nodes are a well-known condition where the first joint of the finger becomes swollen. In fact, it's said that about 90% of people over the age of 40 have this finger deformity. If you leave the condition explained in the video as it is, inflammation can occur, which causes pain, and the joint can become even more deformed, leading to a vicious cycle where the inflammation progresses even further. Heberden's nodes affect many over 40. Even hospitals or osteopathic clinics often say it's due to overuse, so nothing can be done. It's also common not to get a diagnosis or to not be taught the correct way to deal with it. And when it comes to Heberden's nodes, there is all sorts of information out there. Some even suggest draining the fluid from your joints yourself, but please absolutely do not do this. In the worst case, it could destroy your joints or even lead to having a finger amputated, so this is something you must never do. Precautions and what kinds of treatments are available to prevent Heberden's nodes from getting worse, including self-care and commonly used methods. I'll also introduce some supplements. By watching this video to the end, you'll learn about treatments that can prevent Heberden's nodes from getting worse, and you'll also find out what mistakes to avoid so you don't make the condition worse. You'll be able to learn about the right treatments and ways to deal with it. In order to live a vibrant life in the second half of your life, it's important to address finger pain and other issues that may arise. Deformed joints may prevent you from enjoying activities you once loved. Let's learn more together. I'm Dr. Sugu Shinryuka, a general practitioner in Hokkaido. With so much information circulating, some of it inaccurate, I'll take responsibility to share accurate information to prevent regrets from following bad advice. Subscribe to my channel if you'd like, so you don't miss new videos. Now, here's today's agenda. First period, I will clearly explain what kind of disease Heberden's nodes are. In the second period, I will talk about some surprising symptoms of Heberden's nodes. In the third period, we'll discuss whether the pain in your joints is really caused by Heberden's nodes or if it could be another disease, and I'll explain how to tell the difference. In the fourth period, I'll introduce things you absolutely should not do if you have Heberden's nodes. And finally, in the fifth period, I'll share 6 ways to treat Heberden's nodes. In this video, I will be talking based on the guidelines from the 2018 European League Against Rheumatism. So, first of all, what kind of disease is Heberden's nodes? Please take a look at this illustration. This is a drawing of the first and second finger joints. Seeing is believing, so please look at this image first. As you can see, when you develop Heberden's nodes, the first joint of your finger becomes swollen, and as it progresses, the first joint becomes deformed and bent like this. As for what happens to the bone, it's caused by changes due to the cartilage in the joint wearing down. Please look at this illustration. Between the bones of the first joint, this blue part, there is cartilage here. However, when this cartilage wears down, the bones start to rub against each other and become more likely to shift out of place. To prevent the bones from shifting, bone spurs form, causing the bone to grow outward and become jagged. These kinds of changes occur because the bone becomes jagged and larger, the bones rub against each other, and inflammation occurs. When this inflammation happens, pain occurs in the first joint. And actually, Heberden's nodes are often dismissed as being caused by overuse. And while overuse is considered one possible factor, other factors such as hormonal changes and genetics are also thought to play a role. The truth is, the exact cause has not been clearly identified. As I mentioned earlier, it starts to increase rapidly after the age of 40, and it is more common in women. It is said that Heberden's nodes are more likely to appear during menopause, which is when female hormone levels decrease. Actually, there is something called the synovial membrane that covers the cartilage of this joint. It is said that this synovial membrane has receptors for estrogen, which is a female hormone. When women reach menopause and their hormone balance changes, estrogen decreases, causing the synovial membrane to react and swell, which is believed to contribute to the progression of Heberden's nodes. There are treatments that supplement the decreased female hormones, and I will explain those in the 5th section. Also, with Heberden's nodes, there are actually many people who say, "My joints are swollen, but I don't really feel any pain." In fact, 90% of people over the age of 40 have some kind of finger deformity, but it is said that only 5.7% of men and 8.2% of women actually experience pain due to these finger deformities. In other words, swollen joints do not necessarily mean there will be pain, so there are many cases of Heberden's nodes without pain. In the next section, I will explain what other symptoms and problems Heberden's nodes can cause besides pain. Actually, as Heberden's nodes progress, it is said that the fingers become deformed and grip strength also decreases. In a study that followed people with Heberden's nodes for 10 years, there was data showing that grip strength decreased by 3 kilograms. And once you develop Heberden's nodes, you can't move the first joint properly, so when you grip something tightly, it becomes harder to apply force. It has also been found that the symptoms of finger deformity vary from person to person. This finger deformity was studied in 289 people with Heberden's nodes in the Netherlands. In a study that followed patients with Heberden's nodes for 6 years, it was found that those with severe joint pain, swollen or puffy fingers, and higher levels of finger inflammation were more likely to experience progression of finger deformity. In other words, people who have pain, swelling or inflammation are more prone to deformity. So if you find yourself fitting these descriptions after watching this video, I encourage you to listen carefully to the treatment methods I will explain next. Also, just because you don't have pain doesn't mean you won't develop deformity, so I hope you'll watch the video to the end to prevent further progression. For those who are currently suffering from pain, the pain from Heberden's nodes is not caused by the deformity itself. The pain comes from inflammation. So if you can control the inflammation, even if the deformity can't be reversed, you can still relieve the pain. So please listen with hope. However, when it comes to joint deformity, once it occurs, modern medicine cannot cure it. So honestly, I want to address it before it progresses as much as possible. So in the next section, let's learn a bit about whether the swelling in your finger is really due to Heberden's nodes. A well-known disease that causes finger swelling is rheumatoid arthritis. The difference between Heberden's nodes and rheumatoid arthritis is that Heberden's nodes tend to cause swelling in the first joint, while rheumatoid arthritis often affects the second joint, the base of the fingers, the wrist joints, and even the elbows and shoulders. So if you only have pain in the first joint, the likelihood of rheumatoid arthritis is quite low. On the other hand, if you have pain not only in the first joint but also in the second joint or other joints, there is a possibility that it is not just Heberden's nodes, so it is important to get a proper diagnosis. To diagnose rheumatoid arthritis, doctors often use X-rays or blood tests to check for specific antibodies, because rheumatoid arthritis is an autoimmune disease, which means that the immune system, which normally fights off germs, mistakenly attacks your own joints. Because of this, measuring antibodies in the blood helps get closer to a diagnosis. Before you assume it's just Heberden's nodes from overuse and think there's no need to go to the hospital since there's no treatment, it's important to first question whether that's really the case. This is because, for rheumatoid arthritis, various medications have been developed and many people improve by using drugs that suppress the immune system. In addition, there are other autoimmune diseases and infectious arthritis, which can also cause swelling in the first joint like Heberden's nodes. If you look closely, you might notice rough skin, or in the case of autoimmune diseases, you might see rashes or redness on other parts of the skin or redness around the nails. There are many clues to look out for. If you want to learn more about autoimmune diseases, please watch this video. I'll put the link in the description. As a side note, changes in your nails can actually be a sign of illness, so if you're interested, I'll also put a link to that video in the description. Now let's review what we've covered so far. Heberden's nodes start to increase rapidly after your 40s, and while the exact cause is not clear, they are thought to be related to changes in hormone balance, genetics, and overuse. Many people have no symptoms, but about 10% of them experience pain. If this pain is left untreated, the joints are more likely to become deformed, inflammation can progress, and the pain can get even worse, creating a vicious cycle. That's why it's important to address it early on. But before anything else, it's essential to confirm whether it really is Heberden's nodes. It's important to run tests to determine whether it's really Heberden's nodes or if there might be another underlying condition. If you found this information helpful, please don't forget to subscribe to the channel so you don't miss any new videos. Now, in the fourth part, I'll talk about things you should absolutely avoid doing if you have Heberden's nodes. One thing you should never do is pop the fluid-filled sac that appears due to Heberden's nodes. If you're wondering what I mean by a fluid-filled sac in Heberden's nodes, please look at this photo. You can see a swollen bump at the first joint. This is called a mucus cyst, also known as a myxoid cyst. You might have heard of a ganglion before. A ganglion is basically a lump formed by joint fluid swelling up. The ganglion that forms with Heberden's nodes is what we call a mucus cyst. To help you understand what this looks like, please take a look at this illustration. This is a side view of a finger, and here you can see there's the nail and then the joint. And as I mentioned earlier, the joint has cartilage, and inside it there's a fluid called synovial fluid. When this joint fluid leaks out and collects under the skin, it forms a swollen bump called a mucus cyst. In other words, the fluid that collects here is actually, it's joint fluid. So, it's a big mistake to think you can treat a ganglion by injecting it yourself. If you make a hole here, the joint fluid will just come out. What's the problem with that? It's infection. Actually, there are no blood vessels inside our joints. So once bacteria get in and cause an infection, it's hard for immune cells to reach the area. Even if you use antibiotics, it's difficult for them to get to the joint through the bloodstream. In other words, infections in the joints are really hard to cure. So what I absolutely don't want you to do is when you see a bump forming from Heberden's node, don't think it's just a blister and try to pop it yourself. Please, really don't do this. The bump swells up right under the skin and looks transparent, like it could burst at any moment, but you must never break it. In the worst case, an infection can make it so you can't move your joint properly, or you might even be forced to have an amputation or need surgery. Some people might think, then I just need to disinfect it well so bacteria can't get in. But our skin always has resident bacteria like Staphylococcus epidermidis on it, so it's very difficult to make the area completely sterile. In any case, please don't ever break it on your own judgment. There are also other things I don't want you to do. One of them is trying to cure Heberden's node by massaging it. Some people say that since Heberden's node is a lump from overuse, you can solve it with proper massage, but there is no solid evidence for that. There is no data to support that. It might work for some people, but there is no evidence that it will cure everyone if they try it, so please be careful. In fact, if you massage it carelessly while there is inflammation, the inflammation could get worse, the pain could increase, and the deformity could even progress further. It's not that your finger is just stiff or cramped, it's actually a deformity of the joint. Keeping this in mind and understanding the reasons behind it can help you avoid being misled by incorrect information. At YouTube Medical University, we clearly explain the rationale in an easy to understand manner to help you remember better. Now, it's time for the long-awaited fifth period. What kinds of treatments are there for Heberden's nodes? This time, I'll demonstrate self-care methods and also talk about supplements. I'll introduce them in order of priority, so please listen until the end. Here are 6 ways to treat Heberden's nodes. The first is anti-inflammatory painkillers. Anti-inflammatory painkillers are, in the end, they're just painkillers. Many of you might think, I went to the hospital hoping to cure my Heberden's nodes, but the doctor only gave me painkillers. Actually, for Heberden's nodes, these anti-inflammatory painkillers are introduced as a high-priority treatment method. Anti-inflammatory painkillers generally include over-the-counter medications like Loxonin and Voltaren. Actually, as the name suggests, these medications reduce inflammation, and there is solid data showing that they help relieve pain. However, these anti-inflammatory painkillers, these medications can cause side effects like gastrointestinal issues or kidney problems, so it's not recommended to take them casually just because you feel a little pain, considering the balance of benefits and drawbacks. You should consider taking them only when the pain is unbearable, even when you're not moving the joint and just staying still. Many people with Heberden's nodes experience pain when moving, so it's best to rest and avoid moving as much as possible. If you absolutely have to move and the pain starts, you can take a painkiller beforehand. That's another way to manage it. By the way, instead of taking painkillers orally, you can also use pain relief patches or creams. Using painkillers in topical creams can help with Heberden's nodes. This is because since the distance from the skin to the joint in the first joint of the finger is short, it's believed that topical medications like creams can easily reach the affected area. So, if the pain is severe, using anti-inflammatory creams or patches is also an option. The second recommended treatment for Heberden's nodes is moving your fingers. Some of you might be thinking, didn't you just say that moving them makes the pain worse? That's a sharp observation. It's true that if moving your fingers causes severe pain, exercise is not recommended. However, it's been shown that doing finger exercises as much as possible without causing pain is effective. As I mentioned earlier, Heberden's nodes can lead to decreased grip strength. For example, you can squeeze a softball from a dollar store as long as it doesn't hurt, or if the first joint is painful, you can grip the ball using the base joints instead. Doing these kinds of exercises is actually recommended as a treatment for Heberden's nodes. In addition to bending your fingers, there are also exercises where you stretch them out, so please try to find the ones that suit you best. Try practicing these exercises while consulting with your primary doctor. By the way, there is data showing that exercising your hands after warming them in hot water is effective, so it might be a good idea to make a habit of moving your hands while bathing or stretching your hands right after taking a bath. I'll say it again, but it's important to only do these exercises within a range that doesn't cause pain. Stressing already painful joints can worsen inflammation and pain, so be cautious. Exercise benefits not only your hands, but your entire body. The third of the 6 treatments for nodules is to rest the affected area. Some of you might be thinking, if I could rest it, I wouldn't be having such a hard time. And I completely agree. There's probably no one who hasn't used their hands at all today. In other words, it's difficult to avoid moving your hands, but I recommend using tape or a brace to limit the movement of the first joint. For taping, you can do it like this. By wrapping tape around the first joint of your finger, it becomes harder to bend, which helps keep the joint at rest. One thing to be careful about is that if you wrap it too tightly, it can reduce blood flow to your finger, which can actually cause pain or make your finger turn bright red. That means it's too tight, so it's important to wrap it with just the right amount of pressure. However, if you wrap tape all the way around your finger, it can be hard to bend or do detailed work. In that case, you can just put tape on the back of your finger and then place 2 strips of tape across the joint horizontally. Even this can help limit the movement of the first joint. The advantage of tape is that it's easy to do yourself, but the downside is that it can come off easily or lose its effectiveness quickly if it gets wet. Nowadays, there are various types of braces available. Sometimes ring-like braces made of metal tin are used, and there are also small Velcro-secured braces are also available. If you're in pain or seeking improvement, please try these. Taping is likely the simplest self-application method, so start with that. If it works well, explore other immobilization methods. Medical tapes used in hospitals are recommended for their softness, subtle colors, breathability, and water resistance. The fourth method for treating Heberden's nodes is surgical therapy. Surgery is considered when the pain from Heberden's nodes becomes unbearable. For surgeries on the hip or knee, artificial joints can be used to replace the natural joint, allowing you to bend and extend it as if it were your own. However, Heberden's nodes affect the first joint, which is very small. Currently, there is no surgery to insert an artificial joint here. So, what kind of surgery is performed? If you imagine a finger from the side like this, Heberden's nodes occur when the cartilage wears down and, in its place, bone grows out like a spur, causing inflammation and pain. In surgery, what is done is that the protruding bone is shaved down, and then the bones above and below the joint are actually fused together. By doing this, the bones no longer shift against each other. so the pain disappears. In other words, you can probably guess what happens. Because the bones are fused, you can no longer bend or extend the first joint like before. Instead, the pain goes away. In other words, this surgery is about weighing your options, whether you want a finger that doesn't move but is pain-free, or if you prefer to endure the pain and keep your finger's movement by not having the surgery. You decide which is better for you based on these trade-offs. Whether or not you should have surgery is a very individual decision, so if you're unsure, I think it's best to consult with a doctor who specializes in hands, even within orthopedic surgery. And of course, having surgery comes with risks of complications, as I mentioned earlier. Because the fingers have little cushioning, wounds can be slow to heal, and poor blood flow can increase the risk of infection after surgery. You need to consider these risks of complications as well when deciding whether to go ahead with surgery. That's the actual process. How to treat Heberden's nodes. The fifth option is taking supplements. Although the recommendation level for this isn't very high, it's widely used, so I'll introduce it here. As I mentioned at the beginning, Heberden's nodes are more common in women, and one of the suspected causes is a decrease in the female hormone estrogen during menopause. That's why supplements that help replenish this female hormone are sometimes used for Heberden's nodes. In fact, even in today's treatment guidelines, this is introduced as a treatment method for Heberden's nodes. The supplement that is often used contains a component called equol. This is a substance that has a structure similar to estrogen. So, what kind of substance is equol? Actually, when we consume soybeans, the substance contained in soybeans, equol is produced in the body from isoflavones found in soybeans. Because equol has a chemical structure similar to estrogen, it is believed to act like a female hormone. However, it is said that only about 50% of people can actually produce equol in their bodies. For this reason, there have been attempts to see if taking equol as a supplement can help improve joint pain. By the way, there is no solid data showing that equol improves arthritis in Heberden's nodes. However, equol is known to help with menopausal symptoms. It is known to help with facial flushing, irritability, insomnia, heart palpitations, and shortness of breath. There are research results showing that it has been effective. Since menopausal symptoms can also include joint pain, equol is used with the expectation that it will help with these symptoms. Equol itself is produced in the body from soybeans, so it does not have strong side effects. Please consider it. If the pain is really strong, I think one option is to consider equol while consulting with your primary doctor. However, everything can have side effects. If you don't see much effect, you should stop using it early. Also, whether your body is producing equol can be checked with a urine test, so if you want to know more details, I'll put a link in the description. 6 ways to treat Heberden's nodes. Here are the 6 options, and I'll introduce them all at once. These include using other painkillers, getting steroid joint injections, heat therapy, acupuncture, wearing orthotic devices, and taking vitamin D. These are considered weak recommendations, meaning there isn't solid data to support them, but still, since the risks aren't very high, it's considered okay to try them. Other painkillers include commonly used ones like acetaminophen. As for steroid injections, steroids work by suppressing the immune system, so by reducing inflammation, they help relieve pain, which is how they work for Heberden's nodes. And vitamin D might come as a surprise. There's data showing that 98% of Japanese people have low vitamin D levels. For people with osteoporosis, I actually prescribe it at the hospital. It's a very important nutrient that may help strengthen bones and reduce the risk of falls. You can make vitamin D in your body by getting sunlight, but that's often not enough. So consciously eating mushrooms and fish to supplement vitamin D might be effective for Heberden's nodes. Let's review what we've covered so far. One thing you absolutely must not do is puncture a mucus cyst, which is when joint fluid from a Heberden's node swells up under the skin and looks like a blister. Never stick a needle into it or try to break it. This can cause an infection and in the worst case could lead to losing a finger. Also, just because Heberden's nodes are lumps, massaging them will not make them go away, and generally recommended. Treatments include anti-inflammatory and pain relief medications, exercise, and using tape or a brace for immobilization. Surgery is an option if it doesn't improve. Additionally, taking equol, an estrogen-like supplement, is my 6th and weaker recommendation among the options I've presented. If you want to know how to efficiently get vitamin D, I recommend this video. I'll put the link in the description. How was it? This video was a bit long, but by watching it, I think you were able to learn why Heberden's nodes occur, how to treat them, and everything you should avoid. At YouTube Medical University, we share doctors' insights in an engaging and understandable manner, including the underlying reasons. If you enjoyed this video, please like it. It's very motivating. Also, subscribe to the channel to catch all new videos. If you've done something that helped you get better, or if your doctor gave you advice, please share your experiences in the comments section. Let's all learn together. See you in the next video.